With the destroyed parenchymal cells, hepatosplenomegaly can happen, or thrombocytopenia. So, yung kay patient JD, among the two, thrombocytopenia is the most visible one. So this is now called, this now leads to dengue hemorrhagic fever, wherein it increases number of size of the pores in the capillaries, which leads to a leakage of fluid from blood to the interstitial fluid, or the capillary leakage. And then with all the leakage, it also resulted to, it can either result to pleural effusion, or there is a fluid loss inside the lungs, and ascites. And then if this is not treated, or there is no intensive treatment, the patient can either recover, or it can lead to complications such as intense bleeding, pulmonary edema, shock, there is very low blood pressure, liver cirrhosis, or death. Let us now go for the medications. The medications given to patient GD is furosemide, 7 milligrams IVTT now. Now the importance of this medication is because the JD is already exhibiting pleural effusion, and there is already plasma leakage. That's why furosemide is given. So it is indicated for pulmonary edema. The nursing consideration we must do is administer the drug with food to avoid GI upset, arrange to monitor serum electrolytes, hydration, and liver function, and then arrange for potassium-rich diet or supplement potassium as needed. Another one is esomeprazole, 15 milligrams IVTT, which is given once a day. This a proton pump inhibitor used in the treatment and prevention of dyspepsia, peptic ulcer disease, or esophageal reflux disease. The nursing consideration for esomeprazole is to monitor patient for rash or signs and symptoms of hypersensitivity, to monitor GI symptoms for improvements or worsening, and monitor liver function tests, especially in patients with pre-existing hepatic disease. This is given to patient JD since we are trying to prevent further bleeding or hematemesis or whatever bleeding involved in the GI tract. Another one is the diphenhydramine, which is given 10 milligrams IVTT every 8 hours. So it is under the classified as antihistamine or indicated for allergy, symptoms, and sedations. So the nursing consideration for this is that children younger than 12 years old should use drug only as directed by the prescriber. So this is either given to him because of to prevent irritability, so he has to be sedated, or also to prevent allergic symptoms. Since he has petechiae, it is expected to have the presence of pruritus. Another one is the incorporation of KCl of 2 mg to every 100 cc of D5-LRS. These electrolytes and replacement solutions indicated for hypokalemia. So earlier we have seen that he has a decreased level of potassium. That's why treatment of KCl is given to him. So use cautiously in patient with cardiac disease or renal impairment. We must remember that potassium preparations are interchangeable, so verify preparation before use. So it is crucial for pediatric patients. So kailangan tama talaga yung pag-compute ng preparation. And then also monitor ECG and electrolyte levels during the therapy. Another one is the Bacillus glauci or 1 neb, which is given 1 nebule twice a day, after meals. This is under oral suspension and antidiarrheal of microbial origin, which is modified immune system function of the GI tract and believed to be producing enzymes that lead to positive effects. Release antimicrobial compounds and increase production of immunoglobulin. So since the patient is immunocompromised, so Bacillus clausii is one of the medications given to him to protect his GI tract. Moreover, the medical interventions given to him is, one of it is the most crucial one, which is the fluid replacement. So this is for replacement and maintenance purposes. Since there is already, again, plasma leakage, hemoconcentration, the best way is to maintain the balance inside the circulation system. So fluid replacement ginagamit. And then another one is the O2 therapy. Since the patient exhibits pleural effusion, so increase yung respiratory rate niya. So O2 therapy is given. So it allows the body's organs to carry out normal function and prolongs life by reducing heart rate to prevent further complications as well. Let us now go for the nursing care plan. So the nursing care plan I have identified first is the ineffective tissue perfusion. This is related to decreased hemoglobin concentration in the blood. Since he has already hemoconcentration, decreased RBC, decreased hematocrit level, and even the platelet and white blood cells. So what are the nursing interventions involved? First, as usual, it is important to establish rapport to gain the patient's trust, especially the folks, since the patient is a pediatric case. And then we have to monitor vital signs. This is for us to have baseline data as nurses. And then assess the patient's condition to assess also the contributing factors involved. Kung ano na ba yung nangyayari sa kanya every now and then, for us to become updated as well. So we have to note the customary baseline data so we can have a comparison from the previous up to the present data that we have. So we have to perform Blanche test. This is the test for capillary refill. So for us to identify alterations from normal to abnormal. Note the presence of bleeding. This one is very important for us to identify and determine if there is adequate perfusion. And another one is to encourage quiet and restful environment. Siyempre, this is for us to provide comfort with the patient for his rapid recovery. And instruct to avoid tiring activities. That goes again with the comfort we can provide for the patient. And administer medications and to treat this is to treat the underlying cause. The second nursing diagnosis I have identified of patient JD is the hyperthermia. The first nursing intervention, as usual, is we have to establish rapport wherein we can gain trust. Gain the trust of the patient, especially the folks. Another one is to monitor vital signs. As mentioned earlier, this is to also to have a baseline data. Third is to assess neurologic response, note the level of consciousness, and orientation, reaction to stimuli, capillary reactions, and presence of seizures. This is to evaluate the effects and extent of hyperthermia. Another one is to note the presence or absence of sweating, to monitor the heat and fluid loss, because we are trying to determine the cause or monitor closely the presence of hyperthermia. Next is to provide tepid sponge bath every 15 minutes to reduce body temperature. Instruct the client to increase oral fluid intake to prevent dehydration. Administer replacement fluids by using the intravenous fluids he had as ordered to support circulating blood volume and tissue perfusion. And then again is to reassess temperature every 15 minutes to determine effectiveness and interventions used. That's all. Now I'm done with my case presentation. If you have any reactions and comments, just let me know. Thank you.